Welcome to today's video about 10 silent stroke signs you should never ignore. Did you know a stroke might not always manifest symptoms? A stroke, also known as a Cerebrovascular Accident, CVA, ranks among the top causes of death in the USA. Annually, over 795,000 individuals suffer from strokes. The majority of strokes, around 87%, occur because there's a blockage in an artery preventing blood from reaching the brain. From the moment this blockage happens, it's crucial to seek medical intervention immediately when this occurs. Delay increases the risk of permanent damage, as the deprived brain region can die without oxygen. We all know the classic symptoms of a stroke, right? But a refresher doesn't hurt. A cerebrovascular accident has some very distinct symptoms that appear suddenly, such as skin sensitivity, numbness in the extremities and face, speech issues, including slurring, one-sided body weakness, imbalance, difficulty swallowing, among others. Make sure to watch until the end, because there's a list of 10 signs of a silent stroke that are ignored by many people, and probably you are unaware of them. For quick and easy detection, remember the acronym FAST to quickly identify common stroke symptoms. Face. Ask the person to smile. If only one side of their face responds or appears paralyzed, it may indicate an issue. Arm. Request a hug and observe if one arm appears weak or doesn't lift, signaling a potential problem. Speech. Ask the person to sing a song or say a simple sentence, and pay attention to their speech. If they can't, or if they speak sluggishly, it's another sign of a stroke. Time. If you notice any of these symptoms, call 911 or take the person to a doctor immediately. Time is crucial in these situations. The more you delay, the higher the risk of irreversible damage. Now that you've been reminded and know how to identify the classic symptoms of a stroke, let's discuss silent strokes, which, according to some studies, are considered to be the majority of stroke cases in the USA. And this means that most people have it and don't know they do, and therefore, they don't seek help. Staying informed is crucial, especially since untreated strokes are a primary cause of dementia. So, let's move on to the 10 symptoms of a silent stroke. But first, please support our channel by liking this video. Also, subscribe and hit the notification bell to stay updated on our latest content. Share the video with your friends and family to inform them about silent stroke. Prevention is the best remedy to avoid CVA, and many lives can be saved with your help. Number 1. Sudden drowsiness. While drowsiness is often linked to physical fatigue, prolonged work hours, or sleepless nights, drowsiness resulting from a stroke is distinctive. It arises unexpectedly, without any preceding warning or apparent cause. When this happens, the individual's drowsiness tends to persist. They might even fall asleep abruptly, even during a conversation, and fail to awaken. 2. Vomiting and nausea. Experiencing vomiting and nausea, especially when paired with dizziness or vertigo, is another indicator. To identify and distinguish it from other kinds of illnesses, the nausea caused by a stroke typically appears without stomach pain and without diarrhea. 3. Seizures. Another symptom that can sometimes be an overlooked symptom of a stroke is seizures. Did you know that some stroke cases can present as seizures? Hence, it's imperative to note, if an adult who hasn't previously been diagnosed with epilepsy suddenly experiences a seizure, it's essential to rush them to the hospital immediately. It could be indicative of a stroke. 4. Hiccups. Now, a symptom that few people pay attention to, but can indicate a stroke. Hiccups. Surprisingly, hiccups can be a result of a stroke. Specifically, hiccups that arise due to a cerebrovascular event can last for extended periods, persisting for several hours or even days. Thus, if someone has prolonged hiccups accompanied by other stroke symptoms like numbness or weakness on one side of the body, it warrants immediate attention. 5. Pain. Strokes can lead to pain that might be episodic, transient, or persistent. Such pain can manifest on the face, a specific limb, or even half of the body. This pain can serve as a warning sign of other symptoms, like the loss of strength in the affected limb. Sometimes, the pain might even present itself as a headache due to increased pressure inside the skull. It's crucial to note that this pain often feels similar to a burning sensation. 6. Fainting. One of the most common symptoms, often overlooked, is fainting, because there are many conditions that cause fainting, such as malnutrition, low blood pressure, among others. Therefore, whenever you or a family member experiences fainting, see a doctor, especially if that person has a risk factor that increases the chances of having a stroke. 7. Memory lapses. Memory lapses are another prevalent symptom associated with strokes. If you find yourself unable to remember specific parts of your day, or if you reach a destination and can't recall how you got there, it's crucial to consult a medical professional immediately. An even more concerning manifestation is when there's a sudden inability to create new memories following the stroke's onset. 8. Dizziness. Dizziness is a symptom that many often overlook. However, it's essential to understand that strokes can indeed trigger dizziness. Such symptoms should never be brushed aside, so always remain alert and vigilant. 9. Disorientation. If you notice difficulty in orienting yourself in terms of time, the place you're at, or with your memory, this could be a sign of a stroke. Such disorientation often results in a loss of short-term memory. It's crucial to consult a doctor as soon as you recognize any symptom. Reports suggest that some individuals have suffered from multiple mini-strokes, intensifying the symptoms and eventually leading to dementia. 10. Neuropsychiatric manifestations. Stroke can manifest in the form of psychotic episodes. Some cases have reported individuals showcasing only these episodes as the sole symptom of a stroke. It's crucial to note that these symptoms often arise suddenly and without any prior warning. Typically, affected individuals don't have prior medical conditions or histories that would justify such episodes. Always stay vigilant. Now that we know the symptoms of a stroke, let's delve into the causes of cerebrovascular accident and the treatments for strokes. One of the primary and well-known causes of a stroke is high blood pressure. Having high blood pressure increases the risk of experiencing a stroke by 2 to 4 times. Another prevalent cause is heart diseases, particularly arrhythmias. The arrhythmia most associated with strokes is atrial fibrillation, which can amplify the risk of a stroke by up to 6 times. However, it's not just arrhythmias that cause strokes. Several other conditions can lead to this disease. Having a weak heart, a dilated heart, or even blood clots are significant causes of strokes. Smoking significantly increases the risk of experiencing a stroke. For smokers, the risk of a stroke doubles, and the risk of a hemorrhagic stroke quadruples. This heightened risk arises from the inflammation caused by smoking and the increased potential for aneurysms. Surprisingly, diabetes is another common cause. Elevated blood sugar levels can weaken the blood vessels throughout our body. High cholesterol is also a leading cause of strokes. Similarly, obesity and a sedentary lifestyle play crucial roles. Both are associated with hypertension, heart diseases, and other symptoms previously highlighted. So, how is a stroke treated? When addressing a stroke, both the stage and symptoms play a crucial role in determining the treatment. The primary step involves stopping the stroke, followed by addressing its after effects, and finally, taking measures to prevent future occurrences. Each situation varies, with silent strokes presenting unique challenges. It's imperative for the doctor to weigh the risks and benefits of each treatment option. In terms of preventing subsequent silent strokes, proactive measures make a significant difference. The key lies in controlling the associated risk factors. By managing these risk factors alone, it's possible to prevent 9 out of every 10 stroke cases. Some of the possible treatments include using aspirin immediately after a stroke, but if you suspect you are experiencing a stroke, consult a doctor before using aspirin. The medication helps to prevent the recurrence of strokes and reduces the severity if the patient has additional strokes. Treating hypertension is also an excellent way to help prevent strokes. Controlling blood pressure is a very important factor. Additionally, identifying and treating arrhythmias is essential. As highlighted earlier, arrhythmia ranks among the top causes of strokes. So, by getting proper treatment for arrhythmia and improving from this condition, your chances of having a stroke again drop dramatically. Anticoagulant medications are often prescribed in such scenarios, proving beneficial. Moreover, managing cholesterol is crucial. Remember, lower levels of LDL, the bad cholesterol, coupled with higher levels of HDL, the good cholesterol, are desirable for optimal health. For those who've experienced a blockage, surgical interventions such as angioplasty or cleaning the affected site might be recommended. Ultimately, the most effective way to alleviate concerns about stroke is to cultivate healthier habits. Leading a lighter, healthier, and more active life helps you maintain a healthier body with fewer risk factors. In other words, maintain a healthy diet, engage in regular physical activities, and continuously monitor and manage your symptoms under the guidance of a healthcare professional. If you enjoyed this video, please give it a thumbs up. Remember to share it with your loved ones so they also will know the 10 silent stroke signs that cannot be ignored. If you're new to our channel, don't forget to subscribe to support our growth and hit the notification bell so you don't miss out on our next video. We're curious to know, did you know about these silent signs of a stroke? Share with us in the comments below. Before you leave, you may also find some other helpful videos popping up on your screen right now. Feel free to click on any of them, or even better, watch both to continue your knowledge journey with us. Thank you so much for watching. See you in the next video. Bye.